Bismillah, alhamdulillah, wassalatu wassalamu ala rasulullah, assalamu alaikum wa rahmatullahi wa barakatuh. The cold season is upon us, so it's time to talk about the common cold, flu, and compare and contrast it with the dreadful disease of our time, which is COVID pandemic. I have a series of questions to cover the breadth of the problem, and Dr. Mannan is going to address, and at the end we will take questions from the floor, so feel free to prepare your questions and raise your hands at the end. In the audience and in the virtual audience, we have a good number of young people from Pleasant View School and from others who will be in the audience, and the inquiring scientific mind will be addressed in those answers, inshallah. With this, I ask Dr. Mannan the first question: what is the difference between the common cold, flu, and COVID in terms of causation and symptoms?
Assalamu alaikum. Jazakallah khair, Dr. Zaman, Brother Ibrahim, for inviting me to MIC to talk about this. Inshallah, I know that we have a very wide-ranging, mixed group, but I'll try to address it in a way that will be interesting but simple advice as well. So there are two parts to this question. First of all, we want to talk about the actual virology of these three diseases, because, and secondly, we'll go on to the symptoms after that. So the common cold, it's common, but it's actually caused by many different viruses, not a single virus. You might assume that it's just one virus, but actually 40% of the common cold are caused by what we call rhinoviruses. Another 20% are caused by parainfluenza viruses, another 20% by coronaviruses. And I said, what, coronaviruses? Yeah, coronavirus is actually very common. The one that we're dealing with is a novel one. We've never seen it before, but actually it's widespread in the community, and it's actually a very common cause. You may have already had coronavirus. I may have already had it. It actually makes up 20% of the common cold. There's 7 or 8, there are many different types of coronaviruses, but most of them are very harmless, but they can give you the common cold. And then another 20% are miscellaneous viruses such as RSV. So it tells you that there's not just one virus that causes common cold. There are actually lots. The most common is the rhinovirus. Going on to the flu is caused by a different virus as well, the influenza virus. And influenza virus itself is divided into different types of viruses. Not all influenza viruses are the same. So you actually have influenza A, B, C, and D. You could pretty much forget about C and D, because D is pretty much doesn't affect humans. It mainly deals with cattle. C does affect humans occasionally, but it's very rare, so we don't really have to worry about that. So A and B are the ones that are the most common types of flu that give us the flu. But even between A and B, there's a vast difference in the sense that the flu, just like coronavirus, can cause a pandemic. But the only virus out of the flu viruses that can cause pandemic is the type A virus, the type A influenza. So type A influenza is the only virus that can give you pandemic, and I'll explain that a little bit later, just why that's the case. And the A virus, the influenza A, it's also divided into many subtypes. You might have heard maybe a decade ago about H1N1, right? H1, you probably all heard of the H1N1 from the swine flu. Okay, so what kind of makes how are these subtypes divided? Basically, because they have the way we divide them is because they have two proteins. Like when you say H1N1, what does that mean? The H is a protein and the N is a protein. They're on the surface of the virus itself. And there are many different types of H. H stands for hemagglutinin, N stands for neuraminidase, and there are different types, and they give they make up different types of viruses. So you get H1N1 is one type of influenza A virus. Then you can have H7N9. There are different numbers and combinations. But H1N1 is very famous because it's the same virus that also caused the 1918 Spanish flu, okay? And in 2009, it caused the swine flu, okay? So the question is, how do these pandemics occur? And why is only the influenza A virus the only one that can cause a pandemic? And it really comes down to a very basic virologic phenomena of what we call mutations. And there are two types of mutations. One is called antigenic drift and antigenic shift. Okay, I'm just going to very briefly mention that because this explains why pandemics can occur. Antigenic drift is basically when the RNA has very minor mutations, very minor changes, like what we call point mutations. And so what happens is that the H and N proteins can change in very small ways. And that's why the virus changes every year. And that's why you have to have a flu shot every year, because the virus changes a little bit, not too much. Every year it modifies, and that's why, you have to change the vaccine every year a little bit, and that's why we have to have a different vaccine every year, just minor modification. And this antigenic drift, minor point mutations, is happening all the time, okay? But what happens in a pandemic is what we call another type of mutation called an antigenic shift. That's a major change. And in the last, what happens there is that you just don't have little point changes, but you have big chunks of the gene being cut away and replaced. And usually it happens when the human flu virus gets in contact with an animal virus, okay? It can be a pig, swine, bird, And when the parts of that animal virus combines with the human virus, that's when you have major genetic shifts. That's what we call an antigenic shift. And that's what causes pandemics, because then what happens is that the H and N proteins are completely new. There's nothing that the human being has anywhere in the world has ever recognized. And when you have a completely new virus, due to these major antigenic shifts caused by these animal influenza viruses, and they can spread from human to human, and nobody in the world is immune to them. That's what causes a pandemic. And the influenza virus, in the last 100 years, there's been 4 pandemics: 1918 flu, Spanish flu; 1957, 1968, and then 2009 was the swine flu. The swine flu is actually, the H1N1 is made up of genes from the American pigs, the European and Asian pigs, birds, and human. So it's made up of 4 components. That nobody was immune to it. So whoever it infected, they got sick. But fortunately, it didn't last too long. But it gave us a scare. I remember in 2009 when everyone was afraid of that. And then finishing off with the COVID virus is basically, it's a coronavirus. As I mentioned, there's many coronaviruses, but this is a novel coronavirus. Something happened. We don't really know the exact origins of how this derived. People are saying most likely it came from animals, whether it's bats or some market in China, Wuhan. Nobody really knows for sure, but some major genetic change took place that no human being on the earth was immune to, and then it spread very quickly. The reason why it's called SARS-CoV-2, because there was a SARS-CoV-1 back in 2003. That was also a coronavirus. Then there was another type of coronavirus. You might have heard of MERS, the MERS virus, and that is Middle Eastern respiratory virus. And basically that started in Saudi Arabia, and then it went to some Middle Eastern countries as well. But that was a coronavirus as well. And that was in 2012 when it first emerged. It was fatal. Whoever got that, most people died. And just quickly going over some of the symptoms, there's actually a lot of overlap in the disease, and that's what makes this a very tricky and dangerous situation, especially in a pandemic. You don't know if you have the cold or you have the flu because there's a lot of overlap. For example, I'm sure most of you probably had a cold, so you have a runny nose, you have congestion. Fever is unusual in a cold, though. So if if you have fever, you probably have the flu or something else, another virus. Generally, you might have a sore throat, maybe a cough, some sneezing. With the flu, one of the characteristic onset is that you have a sudden onset of back pain and muscle ache. That's very characteristic of the flu. It's often very sudden onset, and then those of you who've had the flu, you already know that you can have the body aches, the chills, the fatigue. You can also have runny nose. But the thing is, you don't get you can get high fever with the flu. You don't usually get that just with the cold. And with children, you can have vomiting and diarrhea. And the dangerous part of the flu is that it can spread to the lungs and give you viral pneumonia. Okay, and so if you have the flu and then you start getting short of breath, then you have to be concerned that you might be developing pneumonia from the virus itself. Now, COVID, those of you who have had COVID, I'm sure you have experienced it. It starts off just like the flu, actually, and you have very much the similar symptoms. You may just have a runny nose. I've had people coming to me, saying that I just have a runny nose, and you test them and they're positive for COVID. So like I said, there's a lot of overlap, and you have to be, and that's why in a pandemic it's a very tricky situation. That's why testing is so important, because that's the only way sometimes you can distinguish them one from the other. And just like the flu, you can have the body aches and the sore throat, the chills, headaches, all that stuff. There is a couple of unique symptoms which you probably have heard of in the media and all that, or you may have experienced it if you've had the COVID infection, and that is the loss of taste and smell. Okay, if you have these symptoms and you've lost your taste and you can't smell anything, you probably have COVID. Okay. And I've seen that in multiple people who've come that. The dangerous symptom that with COVID is that when if you have these symptoms, flu, fever, and then you recover, that's good. The dangerous part is when if you start getting short of breath. Okay, that's when you start worrying and things can really go downhill, and then you can go down the path where you end up in the hospital, in the ICU, and God forbid, death. So these are the basic symptoms, and initially just the virology I spoke about earlier.
Okay, thank you. So this is the cold season. Is there a seasonality to COVID, like common cold and flu? Yeah. Last year, when the COVID was started, we thought that there was a seasonality, because a lot of these coronaviruses that are commonly out there, not the COVID-19, they do have a seasonal effect. They tend to be, more in the winter. But this COVID-19 does not seem to be. If you follow the peaks, if you just follow the historic. Last summer we had a peak, then we had another peak in the winter, and then just this past summer with the Delta we had another peak. So it doesn't seem to be following the seasonality, and so I think that theory is. I don't think we pay attention to that anymore. Excellent. What should one do if they develop symptoms suggestive of cold, flu, or COVID? What should be monitored? Right. What should be done? So both, both cold and flu are spread by droplets. And these are very tiny, aerosols, which. And they can be spread either from in the air or on contaminated surfaces. So if you do develop any of the symptoms that we described, you have to. There's certain things that you should be doing, and also if somebody in the household has these symptoms, they should be doing as well. And I'm just going to quickly go through these because a lot of people already know this from the precautions that we've taken from COVID. For example, wash your hands regularly with soap and water. Avoid touching your eyes and your nose and your mouth with your unwashed hands.
If you are sick, stay at home. Don't venture to go to school, or to work and infect your colleagues or your fellow student. If your child goes to a daycare, keep them home, because in a daycare is a setting where it can, viruses like this can spread like wildfire. Avoid hugging, kissing, shaking hands. I know if you have symptoms, it's very difficult. Like in this kind of environment, people come out, they shake hands. It's difficult to, you feel like you're obliged to shake. But if you have symptoms, just say, it's best to say, brother, I'm sick, I don't want to shake your hand. I mean, if you say it like that, they won't be offended, because people take it personally if you take your hands and don't explain why you're not shaking your hand. So it's okay to just say, brother, I'm sick, so I don't want to get you ill, So if you have these symptoms, don't shake your hands, because that's one of the ways that the virus is spread. And if you are coughing and sneezing, don't cough into your hands, because you're automatically infecting your hands, or you're contaminating your hands. If you have a tissue, use a tissue. If you don't have a tissue, just use your sleeve. Just cough into your arm. The other thing is, as I mentioned, surfaces are often contaminated. If wipe them down regularly with antiseptic, whether it be computer boards, toys, anything that you're using frequently. And one thing is, I would probably encourage, even for even if you're in the house, to avoid infecting your own family members, just wear a mask, because the mask can actually stop the virus, both cold, flu, COVID. It can stop the others around you from getting infected. So even without the COVID, if you have the flu or the cold, wearing a mask in the house can protect your own family members. So I usually recommend that, even in your own household if you're sick. Now the thing is, in this pandemic, obviously. So in this pandemic, obviously a lot of these symptoms overlap, right? So you don't often know whether you got the flu, whether you got the cold, or you got COVID. So testing is obviously, as I mentioned, is very important. And so it's very important that if you're in a pandemic like this, get tested for the COVID and the flu. I mean, there's no test for the cold, right? So at least the COVID and flu, there are tests available. In a pandemic, when you don't know, when you're not sure what you have, just go and get tested. And if your COVID test comes back positive, what do? If you're feeling okay, you're not short of breath, anything like that, you stay at home, isolate in your home for at least 10 days. That's the CDC recommendation, and you stay in home. Other family members that you have should also be tested. Get them tested as well, and they should be in quarantine as well, because obviously if you've been in the household with them for hours and they could very well be infected as well, and they could be in the incubation period. As far as the siblings of kids that are infected, they should all stay at home unless the other siblings have been fully vaccinated, don't have any symptoms at all. They can still go to school as long as they wear a mask, okay? Because we've had this situation in PVS recently. If you do have COVID, one of the things the most important that I recommend people when they call me, what should I do? I sometimes, if you can go and get a pulse oximeter, an oxygen meter from Walgreens or any pharmacy, I would strongly recommend, if you have COVID and you're isolating, that's the most objective way to monitor yourself. Get an oxygen pulse oximeter, because then you can tell whether your oxygen level is going up or it's sinking down. You can't tell clinically if your oxygen level has dropped from 96% to 93%. You can't tell that. But if you have an oxygen meter, you have an objective evidence. And then if the oxygen saturation drops to below 92%, that's when I tell them you better go to the hospital, because things could go downhill pretty quickly. So if you're above 92%, you just gotta watch, be careful. But if you drop to probably below 92%, that's probably the time you should start thinking about going to the hospital. So I think that's pretty much it.
Thank you. So what are the risk of severe disease and hospitalization if someone develops symptoms suggestive of cold, COVID, or flu?
Right. So the risk of, if you get an initial infection, cold, flu, COVID, what are the risks that you might end up in the hospital? For cold, nobody usually ends up in the hospital, okay? I suppose if you're extremely immunocompromised, there's a possibility you could get a little more sick, but in general, nobody ends up in the hospital, so we don't have to worry about that. With the flu, the factors that can increase your risk of ending up or having for you to go to the hospitalization would be things like your age. For example, those who are over the age of 65 have a much higher risk with the flu to end up in the hospital. Those who are unvaccinated, those who have other medical conditions like asthma, diabetes, heart disease, those women who are pregnant are at a higher risk if they get the flu to end up in the hospital. Children below the age of 5, especially if they're below the age of 2, if they get the flu, they can have a higher risk of ending up in the hospital. As far as COVID, what are the risk factors for you to get, for the disease to progress and for you to end up in a higher risk for you to end up in the hospital? There are certain medical conditions that you may have. Some of them, for example, diabetes, okay, obesity, high blood pressure, if you're unvaccinated, and age. The older you are, now before, used to be over the age of 65, but with the Delta virus, we were actually seeing people in their 50s and 40s, who are actually coming up into the hospital. But generally, over the age of 50 or 60, that's when your risk increases quite significantly. And if you have a condition that weakens your immune system, for example, if you're on chemotherapy for cancer, if you're on long-term steroids, if you're a transplant patient, if you have a hematologic malignancy like lymphoma or leukemia, your immune system is already very weak. You may have problem fighting off the virus, and the virus can multiply and progress. And really, any chronic medical condition of the heart and the lung can increase your risk of hospitalization.
Thank you. We'll skip the children questions. What are the complications and what are the risk of dying from flu and COVID?
Right. So the complications and the risk, with the cold, like I said, there's hardly any complication unless perhaps if you're very, very immunocompromised, one of the complications that I personally have experienced with the cold is you can develop a sinus infection. That's rare, but that's one possibility. With the flu, most people recover within 7 to 10 days. But the main complication that you worry about is when it goes to the lungs. You can develop a viral pneumonia, but a viral pneumonia can also progress to a bacterial pneumonia. So the virus damages the lung, and then you can get bacteria on top of it, and then that can actually, the person gets better for a while, and after a few days they get worse, and that they may have developed a bacterial pneumonia. Flu has other more serious complications which are more rare, but they're very well reported. Sinus, ear infection, myocarditis, which is inflammation of the heart, encephalitis, inflammation of the brain, seizures, muscle inflammation, and some neurologic conditions such as Guillain-Barré syndrome, which causes paralysis of the body. And there are certain groups of people that are higher risk of developing these complications with the flu. They're very similar to what I mentioned before. Over the age of 65, diabetes, pregnant, I already mentioned those earlier. As far as COVID-19 major complications, the main one obviously is the viral pneumonia, and because that one where that can not only get you into the hospital, it can actually progress into something called pulmonary fibrosis as well, where the lungs actually start to become scarred, and often when this complication of pneumonia, if you have scarring, it can continue to progress rapidly, and over weeks and weeks, sometimes you just lose the patient. No matter everything you try, the respiratory failure just continues to progress, and eventually the patient dies. And that's the most common way of these people die. Now, you can get other complications such as blood clots. We see that often in these patients. blood clots in the lungs, but you can also get blood clots in the brain. They can actually come in with strokes. And towards when they really get sick and towards when they're close to dying, multiple organs can fail, because of the massive inflammatory response that the body goes through. The kidney can fail, the heart, lungs, and that's when, you've pretty much lost hope. There is one thing I want to complication which can happen when people they think that they've recovered. They've recovered, but they haven't really recovered. And this phenomenon is called the post-acute COVID syndrome, or sometimes they call it long COVID. So about 25% of people who have recovered, they think they've recovered, they may have long-term symptoms for many months, up to a year. Some people who had COVID last year, they're still having symptoms of brain fog. They can't concentrate. They're depressed. Their blood pressure may go up and down. Their heart rate may go up and down. They have constant severe fatigue all the time, the muscle aches, and this can. A lot of people are experiencing this so-called long COVID, and really it's very debilitating. And 12% of people have not even been able to go back to work because of these symptoms. So,
thank you. The next question: what effective medications are available for the treatment of cold, flu, and COVID?
So for the cold, unfortunately, there is no medication. It's all symptomatic treatment. So you get if you're congested, you just have the decongestants and things. So there's no specific treatment for the viruses of the cold. For the flu, there is specific treatment available. We call them in medical terms the neuraminidase inhibitors. So what this does basically. Neuraminidase, because remember I mentioned there's the H and N proteins, H1, N1. So these medicines, they actually attack the N protein. They basically they block their function. And what it does is that, so you have it stops the virus from one infected cell getting into the other. Basically, it prevents the infected cell from releasing the virus, so the virus cannot get to the surrounding host cells, okay? So that's how you contain it. Eventually that cell dies and the virus dies with it, okay? So that's how it works. And in the market, there's actually 3 different drugs that are available. The most common one is the oseltamivir, which is commonly known as Tamiflu. Maybe perhaps some of you have already taken that. That's usually a 5-day course. There's a newer drug called baloxavir. That's just a single dose, just one pill, that's it. It's the trade name for that is Zofluza. And the third drug is zanamivir. It's been around same time as Tamiflu. It's an inhaled drug. It comes in a disc. And it's active against viruses that are resistant to Tamiflu. The problem is that it can exacerbate asthma, and it's been shown to cause catastrophic ventilator failure. So you can't use it in ICU patients because the ventilator will just, it'll fail and the patient can die. So you wouldn't do that. As far as COVID in medications, as far as outpatient, you can divide them into outpatient and inpatient. Really the main medication for outpatient is the monoclonal antibody. That's really the main one. And actually, it's the most effective treatment. But you can only give it when in the early phase of the infection. Once the patient is requiring oxygen, it's contraindicated. You can't give it. In our hospital, I'm mainly based at Baptist de Soto. We've given 19,000 infusions of monoclonal antibody. So that's just in one hospital. So it's been, and the government's paying for it. So but it's very expensive. It's $1,500 per dose. It's very expensive. So there are newer medications, alhamdulillah, new medications that are coming up. In fact, one of them already got approved in the United Kingdom last week. It's called molnupiravir. Okay, it's made by Merck. Okay, and it's a direct antiviral, and it reduces, if you take it early, it reduces your risk of going into the hospital by 50%. Okay, but just, after that came even a better drug, by Pfizer. And in fact, yesterday, they actually, they seek FDA emergency use authorization. So that should be available. Why is that better? Because that actually reduces the risk of hospitalization by almost 90%. And so it will really, this one is really a game changer that inshallah that's coming out, Pfizer, because you know, if you get symptoms, you get COVID, it's like taking a pill. You just take a pill and you take that, and you know, it's like with the flu, you take Tamiflu. Now once this becomes approved, you just take this, and inshallah, you know, important things to take it within the first 3 days, and you actually have to take it with another medication called ritonavir. We use that in HIV. It acts as a booster. It helps to raise the blood levels of this drug that for Pfizer it's called Paxlovid, and inshallah it'll be available soon, I'm sure, and it's going to be a game changer. It'll really help to stop this pandemic. And as far as just quickly inpatient use, I won't go into that because that's the things that we use in the hospital, mainly steroids, a lot of immunosuppressant drugs. There's remdesivir, which is controversial. WHO thinks it doesn't work, you know, but we still use it. So we won't go into that because that's more kind of hospital physician stuff. Yeah.
Thank you. The next question has been answered already. I'll just repeat it if you want to add anything. What are the best ways to prevent cold, flu, and COVID?
The only thing I'm going to say about this, because we already talked about it earlier, is the most important preventative measure is get yourself vaccinated for both COVID and flu. Okay? That's the most important thing, because that is the most important thing. And only today, actually, today the FDA, both the FDA and the CDC, they have both approved the boosters for all adults over 18. So if you have, anybody over 18 can now get a booster. I guess it'll be active in the pharmacies within the next few days. But today was the day that it became approved. So there's no complications. Oh, do I qualify? Do I not qualify? Anybody over 18 can get it. And the other preventative measure that I strongly recommend, even though the Shelby County, the local government has lifted the mandates for the masks, I would still recommend in public places still wear the mask, because the pandemic is not over, and we're even though the infection rates are coming down, everything looks better, but vaccinated people are still getting infected, so you're not 100% protected even if you're vaccinated. So I still wear the mask when I go to Kroger. I still wear the mask in the hospital. We're all wearing masks here, so except me, but I'm talking. So
excellent. We already covered the next one partially. What vaccines are available for flu and COVID? There is no vaccine for cold, right. And should one be concerned about the side effects?
Right. So obviously there's no vaccine for the cold. For the flu vaccine, for the 2021 flu vaccine, it's what we call a quadrivalent, which means that it has 4 inactivated vaccines in one. So in one shot. And so you have an inactivated H1N1 virus. You have an inactivated H3N2. H3N2 is the one that caused the 1968 pandemic. Okay, and then you have those are 2 of the influenza A viruses, and then you have 2 influenza B viruses, the B Victoria and the B Yamagata. So they have the vaccine that is made of 4 inactivated viruses, 2 A's and 2 B's. Okay, and for the elderly, okay. Actually, viruses in general are recommended for any people 6 months or older. But for the elderly, there is a special virus, what we call the high-dose quadrivalent virus. Okay, it's called Fluzone. And this is recommended for anyone over the age of 65 because it's been shown that the regular virus doesn't produce a strong enough immune response in the elderly, anyone over 65. So if you're over 65, ask for the Fluzone, which is the high-dose quadrivalent vaccine. And there's also the other vaccine that's available is the nasal spray called Flu Mist. If you don't like needles, it's also a quadrivalent, those 4 inactivated viruses, and it's approved for ages 2 to 49 years. Now, as far as side effects of these vaccines, really, it's just local side effects. You can get some muscle aches, fever-like feelings, but it only lasts for 24, 48 hours. Initially, there used to be a contraindication if you had egg allergies, but that no longer applies. If you have egg allergies, it's still safe to take these, okay? As far as COVID vaccine, we don't want to go into too much into detail. You already know the ones that are available. In this country, the two messenger RNAs, Pfizer, Moderna, and then the vector vaccine, Johnson & Johnson. As far as the side effects are concerned, if you've had the vaccine, most of you probably have, you've already experienced those side effects, local arm pain, maybe 24 hours of feeling, like you've had the flu, right? There are some rare side effects, very, very rare side effects. There's been some reported allergic reactions, severe allergic reactions, but I have not personally seen anybody with that, but there's reported cases. In teenagers, there has been some very rare reported cases of what we call myocarditis, very mild inflammation of the heart muscle, but it's only lasted for like 2 or 3 days, and they've made a full recovery. So that has not been. The major side effect has really been with the Johnson & Johnson and also with the AstraZeneca and in the other countries, and that has been the formation of blood clots. And it's been it's not just a regular blood clot, it's a very unusual type of blood clot that is formed. Usually in Johnson & Johnson, for women under the age of 50, that's where it's been seen in a few cases. And the blood clots that occur in these cases, they've occurred in the brain, and in the veins of the brain, and there's also some blood spaces called venous sinuses. That's where the blood clots have mainly occurred. And one of the characteristic phenomena of this particular situation is that platelet counts have also really plummeted. So the treatment is actually different from how you would normally treat blood clots, and we won't go into that over here. So those are really the main side effects,
Thank you. Now we're winding up with the last question. What can we expect in the coming months, coming year, 2022, 2023 for COVID? And the second part is the mask use becoming a part of our regular public life. So let's take the first half. Right. What to expect in the coming days, coming months for COVID? So
inshallah, alhamdulillah, overall the pandemic situation is improving a lot. One of the measurements that we use is what we call the positivity rate. Positivity rate is when we test, they do a certain number of tests every day, what percentage of those tests come back positive. That's the positivity rate. When there's a lot of infection going around, the positivity rate is really high. So just 3 months ago, when we had the Delta peak, the positivity rate was like 30%, 20s and 30%, really, really high. So that's why you had all those lines, in front of the lab. You had to wait for 2-3 hours to get a test. So now the positivity rate has come down to around 2.5%. Today's was 2.5%. That's very low, but still, alhamdulillah, that's the lowest it's been in a long time, and alhamdulillah, it's staying low. It's staying between 2 and 3%. We want to get it below 1%. Inshallah, if we can get it to 1%, maybe we can start, we can start standing next to each other and praying normally, So inshallah, we'll come to that soon. But right now, 2.5%, it's really low, but we still have to be careful, So the key to eliminating the pandemic is to really get everybody vaccinated as much as possible. Right now, in the USA, 60% of the population is fully vaccinated, but it's unequally distributed in the country based on red states and blue states, And you need about 75 to 85% of the whole country to be fully vaccinated to reach what we call herd immunity. Herd immunity is when there's enough people vaccinated that the virus cannot spread and eventually just fizzles out. Okay. It's also important. It's not only important to vaccinate people in our country, but around the world. Why? Because if you don't vaccinate, if other countries, poorer countries, they're not vaccinated, you're going to get emergence of variants, mutations, And these viruses, these mutant or variants, can be dangerous. That you might get a variant that will be resistant to all these vaccines. Again, we'll be starting to square one. So it's important that we get everybody in the world vaccinated. It's very important, not just us. This pandemic cannot go away until everybody is safe. One other issue one other point to make about is we need to try to address this vaccine hesitancy. Vaccine hesitance is, it's getting better, but, there are many reasons for why people don't want to get vaccinated. A lot of it is because of misinformation on social media, which is very common. It could be for political reasons. It could be for historical mistrust of the government, which a lot of African Americans know about. We won't go into that, how they were abused in the 30s, 40s, and 50s with for example, the Tuskegee scandal in Alabama. And inshallah, this new medicine like the Pfizer vaccine, that can make a big difference. The Pfizer medicine, the pill, that can make a huge difference, to cut down this pandemic. As far as mask wearing is concerned, I'll end with that. Basically, already mandates have been removed. People are, you go outside, a lot of people are not wearing masks anymore. So I think moving forward, mask wearing is going to become an individual preference, I think. Some people are not going to wear masks. Other people are going to continue to wear masks for maybe for the next 1 or 2 years. My partner, who's an infectious disease, he said, I'm going to wear it for the next 2 years. So it's going to be an individual preference. At this point, I would strongly recommend you still wear it in public places, for sure. It's not over. We're in a much better place than we were 2 or 3 months ago. But inshallah, in the coming months, as things improve, then you can rethink that.
Thank you very much. We'll take questions from any of you. Thanks for staying on the program and listening to us. Dr. Mannan gave us a lot of information, inshallah, of benefit to us. So we'll ask anyone to ask a question, brother.
Yeah, as far as COVID testing, we hear about the rapid test and the PCR test. We hear also that the rapid test accuracy is not that great. So doesn't that defeat the purpose of doing the
Right.
test? Now, the other part, the PCR test, when we travel outside the country, they require a PCR test within no more than 72 hours. So when we do that, should we feel safe when we are in the plane? Let's say
Right.
somebody did 48 hours PCR test, and then within the last 24 hours,
Right. So let me tell you. So the question is about the COVID, the rapid antigen and the PCR. The rapid antigen, it's true, it's not as accurate as the PCR, but it's still a good test. I mean, in the hospital, in fact, it's a good screening test. For example, in the hospital, every patient that comes gets a rapid test. Okay, if we have any doubt, for example, they're having symptoms or something, we do the PCR. Okay, for confirmation. It's a more accurate test, but still, it's a good screening test. In fact, now even in the PVS, for example, Pleasant View School, we're actually doing the rapid test now, because with the PCR test there was a lot of delay. Because you can't get it back. It takes like 24 hours to get the result. So in that 24 hours, there's a lot of confusion, concern. So it's good to there are benefits to the rapid test for sure. But if there's any doubt, you have to go to the PCR. The reason why the airlines require PCR is for that reason. It's a more accurate test. The 72 hours, it's more of a practical thing, because, it takes, some places takes 48 hours for the results to come back. And you're going to miss your flight if you don't get the results. So it's more of a practical thing. But you're right. If it's not 100%. I mean, you have a negative test, and in 72 hours, you might be incubating. Right, you could be incubating, but and you might not have enough virus so yeah, it's not 100%. That's why a lot of people are now moving towards requiring vaccinations to reduce that risk. So for example, anybody that in USA, for example, now anybody that wants to travel to the USA is now going to require vaccination. They can come here, they need vaccination, but they also need a negative test in the first 72 hours. Yes.
That's nice.
We're doing this session very beneficial. So the question is, a vaccinated person can still pass on the virus to somebody else, right? So how much lower is their chance of passing it on versus somebody that is not vaccinated?
Yeah. So that's a good question, and especially it was really relevant. That question is really relevant with this Delta virus that we just experienced, because a lot of people thought that after getting vaccinated, they're invincible, right? They're not going to there's no way they can infect. But a lot of people were getting, I know personally some people were vaccinated. So what is the difference between a vaccinated person getting infected and an unvaccinated person getting passing it on as well? So what happens is that the reason why the Delta virus, the one unique characteristic of the Delta virus is that it causes a massive viral load in the body compared to the original virus. So there were studies that were done that showed that any person who are infected with the Delta virus, their viral load, meaning the amount of virus in their body, is up to 1,200 times higher than what was seen with the original virus. Okay, so that explains why the vaccinated people are sometimes infected, because the virus load is so high. Initially, it can overwhelm your antibody response from the vaccine, but eventually, if you're vaccinated, since you already have some antibodies, you eventually will recover. You will recover, and so there's a short window where your viral, even if you're vaccinated, your viral load may be high, and that's the time where you can spread, okay? But that's a small window for vaccinated people, okay? That window is small, and eventually it will close. And, after a few days, you'll recover, you'll be fine, you no longer will be spreading, With unvaccinated, you don't have those antibodies to protect you, right? So that huge viral load that attacks you, because you don't have any natural defenses, they just continue to multiply, and that's when the disease progresses. You not only are spreading it, but your own disease progresses very quickly, and that's why we see 30-year-olds, 40-year-olds, 50-year-olds dying in our ICUs because of that reason, because they have no natural protection, and the disease progresses very rapidly, and they can go into respiratory failure, they end up on the ventilator for weeks and weeks and weeks, and it's a lost battle, So that's the difference, with a vaccinated one, initially it's just a short period where you're contagious,
Excellent, Brother Heil.
You mentioned H1N1. I'm just curious. The COVID-19 protein spikes, are they all homogeneously uniform, the same protein?
Repeat the question for the online audience.
Yeah. Can you just you mentioned that I heard the H1N1 and then what did you?
H1N1.
Yeah.
Virus.
Yes.
On COVID-19, the protein spikes.
Yes. Yes.
Are they all homogeneous, uniform, same protein?
Okay, so repeat the question for the online audience.
Yeah. So you're saying that the spike proteins, are they all homogeneous? Are they the same? Right. Yeah. Well, they're not all. In one particular virus, one particular coronavirus, there will be minor differences, but they have a basic structure, a basic, But then again, you have the different variants, right? And there are actually many different variants which have different structures in those proteins. We know of the Delta variant. We know the UK and the South African variant.
I'm not talking about the variants and the mutations.
Yeah.
I'm talking about the actual virus at a given point in time.
Same.
Taking Delta virus, is all the proteins, the spikes on it, that go into the cell?
For that particular virus, yes.
Without mutation.
For that particular virus, yes. They're all, those spike proteins are the same, yes.
Without mutation. If mutation, then 4 different proteins are common in Delta virus.
Right.
And the number of mutation can be different for different variants. So without mutation, they are similar, unlike H1N1, which is different.
Right.
So, Brother Taisir.
When should you take the booster if you had
When should you take the...
If you had the original, the 2 shots before,
So the question...
when I had corona?
you had the infection, the natural infection?
Okay, so the question is, when do we take the booster or the 3rd dose if you had taken the 2 initial doses and also had the natural infection?
Did you have the natural infection? Not you, in theoretical, you're saying that you had the vaccine and then you had the natural infection after the vaccine. And then 6 months after the vaccine, you had the natural infection, okay? The recommendation for taking the vaccine, initially there used to be the recommendation that you should wait, right? But now the recommendation is once you are out of your quarantine period, go ahead and take the vaccine, as long as you've passed the 6-month period. The booster is taken 6 months after your second dose. Okay, so if you pass 6 months and you develop a natural infection, then you can take it as soon as you come out of isolation. You can take it as soon as, you don't have to wait.
Yeah, just to let you know, I was vaccinated 9 months ago, and about 8 months into my 2 Pfizer vaccination, my antibodies were 0. Last month it was 0, so I took the 3rd shot just 2 weeks ago. So my son, who is younger, his antibodies were still good. So it's interesting that a younger person seems to have lasted a little longer.
Did you check specifically the spike protein?
No, it's just a generic antibody.
Okay, no, then yeah, that's another thing. If you check your antibody and you want to see whether you have immunity to the vaccine, you have to specifically request for spike antibody testing. If you ask just for a general antibody test, if you've never had the natural infection, the antibody will be 0, okay? But if you've had the natural infection, you'll have, the antibody test will be positive. So if you want to see your response to the vaccine, you have to specifically ask for, I want the COVID spike antibody test, spike protein. So it's a different test. And at the beginning, I remember we had a lot of confusion with that. People were saying, oh my gosh, I got vaccinated and my antibodies are 0. And that's the reason why, because the tests are different.
Yes.
Okay.
So 6 months from the illness should be vaccinated.
Yes. Well, actually, 6 months from the 6 months from the last vaccine dose. So if you had your second dose 6 months ago, you can take the booster now, whether you had infection or not.
Indeed, the infection is not given a lot of weight in deciding about vaccine in North America.
Yeah.
It may be different in Europe, but in this country, the NIH and CDC does not give a lot of weight to natural infection because the immune response widely varies. That's the official position.
You want to get vaccinated as soon as possible, but the reason is the immunity that you develop from vaccination is a lot more high quality than the immunity that you develop from natural infection. We don't want to go into that detail, but because the vaccine has a very specialized immunity. All your immune system is targeted towards the spike protein. Whereas a natural infection, you're looking at all different parts of the virus. So it's more like a general response. It's like a generalist and a specialist. So that's why the immunity that you get from the vaccine is a more specialized response, and that's why you're encouraged to do that.
Thank you, Brother Ali.
Are
we going to require annual boosters going forward is the question.
Yeah, we don't know that yet, I think that answer it's very possible. It's very possible. But the good thing is that this virus doesn't change as frequently as the flu virus. In the beginning I mentioned about the antigenic shifts that occur all the time. That doesn't occur with coronavirus. That phenomena doesn't occur. So that's a term specifically used for flu. So we may or we may not. I think we're going to have to wait and see on that one. Yeah.
Other questions, Mamun?
Yeah. You take your mask off.
You just say it and I'll repeat your question.
What is your recommendation on who should think about getting the monoclonal antibody infusion?
The monoclonal antibody, the monoclonal antibody is
Who should take the monoclonal antibody is the question.
Yeah. Well, now it's actually, for those who are infected, basically, right? Monoclonal antibody is only for those who have a positive COVID test, So when it first came out, because of the reduction in supply, it was mainly for people who are high risk. So there's actually a certain list of people, immunocompromised, elderly, diabetes, age, things like that. But then once the supplies became more available around the country, then anybody who has a positive test can go to, come to DeSoto and get the monoclonal antibody, But that may, remember I said it's very expensive. If this Pfizer drug becomes approved soon, I would rather take a pill than get stuck, with a needle and, get an infusion of monoclonal antibody. I would rather take this pill. So I think this pill if it's as effective as the trials show, it may replace the monoclonal antibody.
Excellent. Other questions? We're about 60 minutes into the program. Brother Najmun Noor.
Walaikum salam.
Thanks so much. Now, my question, I come from Bangladesh, but there's so many brothers and sisters who come from India. Now, we also travel to Bangladesh quite a lot. Now, we know for a fact that the borders are porous. The borders, people coming from India, they cause a lot of, there was a lot of issues that we faced about 6 or 8 months back. Given that situation, there are no controls. Now, when we travel to Bangladesh, there's always a concern. The issue that you projected for us, would that apply also to India as well? We know for a fact what happened in India. People lying in parking lots, they were giving oxygen tanks, and they were being infused with oxygen.
Yeah.
Now, do you have any recommendations, suggestions, how to, it's something very recent in the global context, but then this is something that has happened to us. And for people from Bangladesh have been literally affected on account of that.
Yeah. Well,
So specific question I need to repeat so the online audience can hear it. The specific question is there any recommendation to prevent severe disease, oxygen therapy?
No, what I meant was that was totally, totally out of the blue.
Yes.
That, what happened to Bangladeshis and also Indians, we were totally scared, panic-stricken. But what happened later on, that it carried over to Bangladesh. There were no border controls, and not like totally unlike Canada and America. And given that situation, is there any recurrence that might happen in future again?
yeah. Well, if it just didn't go to Bangladesh. It went to the whole world. I mean, the virus that we experienced in the summer, the massive peak, that is the same virus that came from India. It's the Delta virus. So that Delta virus actually didn't just go to Bangladesh. It spread to the whole world. So I mean, alhamdulillah, the good thing is that with the Delta virus, because the Indian virus that you're talking about, that is the Delta virus, and what even though what we saw when it spread to Europe and it spread here, and even in Bangladesh, we saw a massive peak, very massive peak, but it actually came down pretty quickly, right? Like in Bangladesh, I remember because I actually traveled there, in late August and that time, but in early August and in July, people were dying in the 200s and 300 per day. I remember that, the figures, right? And people were just terrified. And so there was a massive peak, and people were dying, just like over here, 3 months ago, there was a massive peak. People were dying, 30-year-olds, 40-year-olds, right? But then it just came down, within 2 months, it came down. So India had a pretty similar thing. Massive deaths, I mean, I know in my Indian physician colleagues, every single physician I know here has had a family member, 3-4 people that have died in India, I mean, but then it came down very quickly, so where that's the reason why it's so important to get everybody vaccinated, not just the USA, but everybody in the world, because you don't want a variant to come out like the Delta variant, with something that's more dangerous than the Delta, that is going to be resistant to our vaccines. So alhamdulillah, all the variants that are out there right now, the vaccines are effective. So inshallah, if we can stop the pandemic, inshallah, we'll stop it permanently, at least until the next one.
I think we're going to bring, yes, last question, inshallah.
Okay, 2 parts. What's the age recommendation for the kids to take the vaccine shot? And the other part, you mentioned there's new medicine for COVID, and Pfizer is going to have one, but you said it really takes effect if you take it within the first 3 days.
It's most effective within the first 3 days. Yeah.
First 3 days. Like first 3 days of the symptoms?
Yes, first you have the symptoms.
So let's go. The 2 questions the brother asked. One was the minimum age where the child could be vaccinated, and the second one is the COVID pill from Pfizer or Merck. it has to be taken early in the disease, just like the flu pill has to be taken within the 3 days to be effective. So if you want to respond.
So as far as children are concerned, the vaccine has already been approved for 5 to 11. In fact, PVS is going to, we're going to start introducing the vaccinations there next week. I'm going to offer that to the parents, and so it's already been approved. So if you have a child between 5 and 11, you should get it. The vaccine for the child is 1/3 the dose of the adult. It's a much smaller dose.
14 years old, for example.
14-year-olds? Yeah, 14-year-olds. They were approved back in April.
Take the same shot.
They take the same as the adult.
Same shot.
I mean, I have 3 teenage children. All of them are vaccinated. They got the same vaccine as me.
And the
But the children from 5 to 11, it's a much smaller dose. But it's already approved.
And
Yeah.
the pill question.
The pill, I think I just answered that. I mean, usually it's not approved yet. They submitted it for approval. So when it does become approval, the recommendation will be to take it within the first 3 days of your symptoms. Now, you can still take it after that, but it may be less effective.
Okay, I think, thank you all very much. There's one question. We approaching a time when families come together, right?
Yeah.
Next weekend and the months of December, end of December. General recommendation, very briefly. When families come together for dinner, gathering, what do you say?
I think if you are going to have a family gathering and you know the people that you're going to mix with are all vaccinated, they're all symptom, they're healthy, they're doing well, it's okay to gather together. And I don't have any problem not wearing masks in that situation, as long as you know the people. But when you're in a situation where there's a lot of, like if this hall was full of people right now, I would be very nervous because I don't know who's vaccinated, who's not vaccinated, who's infected, who's carrying. If you're in a situation where you don't know the people around you, then you should be careful, okay? But if you know the people, there's no harm in asking them beforehand, is your family vaccinated? They'll tell you yes or no, and then if everyone's vaccinated, it will make everybody feel better. But I think it's good to have gatherings. It's important to have gatherings. We still, that's how we, stay mentally, healthy by social gatherings. So I think, but I think, be careful, please. We all need to be a little careful. That's
Alhamdulillah, Jazakallah khair, Brother Ghalib. The community is blessed with specialized resources like Dr. Mannan, right? Alhamdulillah for that, and lots of interest in the questions. We probably will do another one, inshallah, in coming days. May Allah bless you, your family, reward you, and bless all the audiences who is live here and virtually present for listening to this forum. The goal of this program is called Wellness, Health and Wellness. Inshallah, in coming days, we'll talk about health and wellness concerns that you can recommend, subjects that you want to hear about once a month. Second Friday of the month is what Dr. Sultan Ali has proposed. So, inshallah, talk to us what you want to hear. December, there will be a session, January, February going on, inshallah. We want more participation, more interest for family, children, everybody to understand what factors go into keeping us healthy. Health and wealth is part of our iman, our religion, our spirituality. With this, subhanakallahumma bihamdika ashhadu la ilaha illallah wa astaghfiruka wa atubu ilayk. Subhana rabbika rabbil izzati amma yasifun, salamun alal mursalin, walhamdulillahi rabbil alamin, wa alaykum salam wa rahmatullahi wa barakatuh.
Assalamu alaikum.